Good morning. It's an honor and a privilege to be here with you this morning. Members of the Public Policy Institute, AARP, and faculty at the Betty Irene Moore School of Nursing, who are also members of the Latino Aging Research Resource Network Center, are beginning a collaboration to advance services and supports for multicultural caregivers. And in that effort, we decided we wanted to find out what's the evidence for what we're wanting to do. And we decided to conduct a comprehensive review of the published literature, peer-reviewed work over the last few decades, looking at the evidence for multicultural caregiving. And I'm going to give you a very quick overview of a very large database. Over the last 23 years, the study period goes from 1980 to 2013. There were 238 articles published in the peer-reviewed literature. We searched about 9 different databases. We used at least 10 terms to identify family caregiving. We looked at multiple ethnic groups, racial and ethnic groups, and we looked at, really restricted it to older adults, caring for older adults. So in all of those years, 238 articles were published, which to me seemed a little bit short, considering the time and the amount of work that we need to do in this area. But 238 were published, and we categorized them in general sense, and I'm going to give you an overview of the descriptive side of it, and then give you some insights into some of the trends and themes that we saw, and finalize with some recommendations going forward. As you can see from this table, there were 238, and 218 of those were formative or descriptive types of studies, and 20 of them focused on interventions, and the 20 in total across all the different ethnic groups that are represented. At the same time, 220 were cross-sectional, and 18 were longitudinal. And as many of you know, caregiving is a long-standing commitment and usually takes place, the average is around 5 years, and the range of caregiving can be into the decades. And so having cross-sectional studies, as you can imagine, is a very, very large limitation in understanding the experience of caregiving. And then looking at methods and approaches, predominantly qualitative research, so a very rich set of insights into what does it mean to be a caregiver, what's the experience, what are the resources, what are the approaches that might be possible. Much less in looking at predictive models and looking at interventions that are actually tested and the evidence for the interventions established. So we're very early, if you look at this table, in the field of understanding multicultural caregiving by the maturation of the kinds of studies that we saw. So our observations in general at a high level were that most of the work that's been published is very descriptive, that Latino and African Americans received the most attention, followed by Asian Americans and Native Americans, only 6 studies in over 20 years. Which is a very small number, particularly when you think about the diversity of tribes and groups within the Native American community. 2/3 of the studies used qualitative methods, and there was a much broader perspective on a caregiving network. When you look at the Caucasian literature, very much of it is dyadic in nature, so looking at either spousal caregiving or adult children, but usually one primary caregiver. In this literature, a much broader definition of family, a much more inclusive sense of who's part of that network, kin and kith who are part of this network, and also the power of sociocultural influences. This is a very busy slide that just gives you a very quick overview of some of the themes and ideas, and the experience of caregiving across these different ethnic groups really is shaped by very powerful social, political, societal forces. And they're unifying themes across these groups, but they're also some very distinctive types of experiences. And again, these are qualitative studies that occurred in groups, small groups, none of which really capture the full experience. When you think of Latino, for example, there are many, many different groups and backgrounds, heritage, countries of origin that comprise that group. Similarly with African American, the Caribbean origin African Americans versus those from Africa. Various distinctions among the Asian American group, where there are so many different countries of origin, languages, and cultures. But across the board, what you can see here is really a sense of care being bigger than the individual, that there is a sense of community and network that is defined in a very fluid manner, that there's a combination of experience relating to the caregiving, both expectations of role as well as the burdens and rewards, the motivations that are in play, and then some of the issues that families encounter as they're working with the community and formal services. Particularly in the African American group, a real call out to racism and discrimination. But across the board, distrust of institutions and approaches, concerns about the applicability and the appropriateness of the care that's provided. And along the experience are the complex issues of communication, conflict resolution, and dissonance that people experience as they're engaging in this role. So a very complex set of experiences. Clearly a trajectory that's in play, and it's unclear what that trajectory looks like. It's very, very likely as individual as the people who are experiencing it, and as the conditions that are driving the caregiving situation. Overall impressions as we looked at this rich database included realizing that with the lack of longitudinal understanding, we really don't understand the trajectory well enough to anticipate and to be able to manage in that way. The interventions predominantly focused on a stress and coping model, which gained a lot of popularity in the 80s and really was applied in a great deal within dyads and focused on psychological supports, dealing with coping and also problem solving and some education. But in many respects, when you look at what's going on in terms of the experience of caregiving, that's a narrow approach to think about the issues. When there are much broader societal issues, there's communication and conflict and role enactment and skills, a variety of different topics that come up that aren't addressed by the stress and coping model. Very clear importance of the community, and a dearth of interventions that actually look at the network of caregivers and how to mobilize and sustain that network over time, and deal with issues such as advanced planning, which are so crucial. Very limited studies looking at the potential of technology, and this is a surprising finding actually when you look at the growth of technology in society, and particularly among older adults as adopters of technology. So some of the recommendations that we felt would be important coming out of this review of the literature were that we needed to think about the heterogeneity within groups, that there's this question of lumping and splitting that you have often when you're looking at research design and then also interventions. And clearly by lumping, we are losing a tremendous amount of the meaning and the experience behind what's going on for caregivers. That the conceptual models for research clearly need to be expanded, that thinking in an individualistic way and thinking about it as simply a matter of coping is really grossly inadequate to take into consideration many of the social, economic, political forces in play, particularly when you look at what helps a network grow and be sustained, what are the economic implications for people who make these very difficult life choices in caregiving. And we may learn quite a bit from family development, from thinking about feminist ideology, because the majority of caregivers remain women, stigma and discrimination, and some of those sociological perspectives that could help us understand the phenomena better. And then looking at the network and dynamics way beyond the blood family and defining family in a very broad and generous way to include neighbors and friends and others who a person would value as a support. And the longitudinal aspect, both in terms of understanding the experience, but also in terms of understanding what are the appropriate services and supports that might be salient at various times in this trajectory. Related to that is the dual trajectories or the multiple trajectories of the family. And oftentimes in an aging family, it's hard to find who the caregiver is, that there are actually multiple needs within, and there's a reciprocity and a mutual engagement that makes it work. And understanding and recognizing that in a given family there may be more than one recipient and definitely more than one caregiver, and how those trajectories unfold over time. And then finally, looking at the sociocultural barriers and facilitators that make all the difference in the caregiving experience. The powerful social determinants that we know affect health, but very much shape the family caregiving experience. So in closing, this work demonstrated that we have a very rich set of understandings about experiences in a limited number of groups and a limited number of locations, but it's enough to begin to build a more robust understanding for interventions. And clearly a great deal is happening in the community in a very collaborative way in terms of interventions, but the evaluation and the evidence base for those interventions remains to be explored. Thank you very much.